You're watching CTOM TV. Knowledge is power.
So the standard treatment for prostate cancer typically follows treatment that we have for many different cancers, and that would be surgery. And surgery is always the best way to get rid of a cancer, providing it hasn't metastasized.
Oh, Alex,
yes.
Sorry to interrupt you, but truly with good intent. What I didn't write in here, because I wanted to ask you more, and now's the perfect time. In my reading and preparing this document and getting ready for this presentation, there was a lot of talk about how in standard cancer care, based on folks' PSA number, even if something is there, and even if they know it's malignant, watching and waiting is a very common approach. I didn't put it on here, but can you speak to that as well?
Yeah, if you have a low-grade prostate cancer, by the Gleason scale, typically that means it can be very slow growing, and it may not be a problem, and it may not metastasize. And there are definitely cases of that. We kind of live in a different world at CTOM. We get all the difficult cases. If there's cases that are unique and difficult that don't respond to standard care, they usually get sent to us. But importantly, the waiting method is never a good idea. I understand in a political sense and a business sense, when you're dealing with a lot of people, you want to stratify cost versus risk. And that's part of standard business model and statistics. But if you are an individual, and I speak to the individuals because our goal is to work from the bottom up rather than the top down. We want to work with the individual patient, and we want to look out for the best interests of the patient. We're not looking out for the best interest of the medical system. We're looking out for the best interest of the individual person. And so if you're being told to watch and wait, I would say don't. Get it out. There's a chance that they're wrong. And if you haven't looked at the genetics of your cancer, the Gleason scale is not necessarily the only thing that can be done. There's a lot of variation in prostate tumors. In every tumor, you can get a biopsy of a non-aggressive part, and then there could be a very aggressive component of that tumor that the biopsy just missed. And in fact, often the case is that once a tumor is removed, it usually has a much higher grade than the biopsy originally confirmed. So when you get a biopsy, it may be grade, 2 or 3. And then after surgery, oh no, sorry, we've actually now seen that it's actually more like a grade 7 or 8. Mm-hmm. So yeah, surgery is always the best with cancer when possible. And in Canada, they like to do a lot of waiting and seeing because it's cost effective. Mm-hmm. Mm-hmm. So surgery, and then there's also brachytherapy. There's external beam radiation that was used for many years and still is. Brachytherapy is where they put little rods or tubes, little radioactive rods, and they insert them around the tumor. They can also use little tubes where they actually run a radioactive solution through the tubes, kind of like on a car, the radiator of a car. And so that radioactive fluid is put around the prostate, and they do that, a few times. The rods are installed directly around the tumor. So, brachytherapy is an effective treatment, but once again, you're leaving the tumor in, you're leaving the tumor microenvironment in, and often the things that cause the tumor, the stem cells that have caused the tumor in the first place are, 5-6 centimeters, sometimes depending on the organ, of course, are a short distance away from the actual tumor. So once again, surgery is always best.
Thank you for watching CTOM TV. Subscribe below and stay informed.